Personnel should be properly gloved and should be wear mask and gown. Equipment should be all sterile. Delivery of the baby, call out time of birth and sex. Within first 30 seconds, dry the baby using a clean dry cloth to thoroughly dry the baby by wiping the eyes, face, head, front and back, arms and legs. Provide warm by removing the wet cloth. Do a quick check of newborn's breathing while drying. Evaluate by Apgar scoring. If after 30 seconds of thorough drying, newborn is not breathing or gasping, reposition, suction, and ventilate. Clamp and cut the cord immediately. Call for help. Transfer to warm, firm surface. Inform the mother that the newborn has difficulty breathing and that you need help with the baby to breathe. If after 30 seconds of thorough drying, newborn is breathing or crying, put the baby in skin-to-skin contact with the mother. If not without complication, avoid manipulation, such as routine suctioning that may cause trauma or introduce infection. Place the newborn phone on the mother's abdomen or chest skin to skin. Cover the newborn's back with a blanket and head with a bonnet. Place identification band on the ankle. Within 1 to 3 minutes to delay on or non-immediate cord clamping. Clamp and cut the cord after cord pulsations have stopped, typically at 1 to 3 minutes. Put the ties tightly around the cord at 2 cm and 5 cm from the newborn's abdomen. Cut between ties with sterile instrument. Observe for oozing of blood. Within 90 minutes of delivery, provide support for initiation of breastfeeding. Leave the newborns on mother's chest in skin-to-skin contact. Observe the newborn. Only when the newborn show feeding cues, for example, opening of the mouth, tonguing, licking, rooting, make verbal suggestion to mothers to encourage her newborns to move toward the breast. Counsel on positioning and attachment. When the baby is ready, advise the mother to start breastfeeding of the newborn's baby. From 90 minutes to 6 hours, do physical examination, weigh, measure, eye care, inject 0.01 milligram of vitamin K, IM into vastus lateralis muscle, Hepa B, BCG, transport to room together. After that, 6 hours do optional bathing. Place the infant at the bathing area. Never leave the newborn at the area alone or unattended. Using a sterile gauze or cotton ball with oil, wipe off the vernix caseosa, starting from the face going down to his feet. Do not remove all the vernix caseosa. Use warm water in bathing the newborn. Test for the temperature. After that, apply mild hypoallergenic shampoo and wash the hair and scalp thoroughly. Caution: always support the newborn's head and neck when positioning or moving the infant. Wipe the eyes with plain water either with cotton ball or soft gauze from inner to outer canthus, using one cotton ball in each eyes. After that, using a mild soap, wash the face, ears, neck, and body, and also paying attention to the creases and folds. After that, rinse and dry thoroughly the newborn. If there is any danger of dying, some parents wish to have their child baptized. The nurse should be responsible to follow up or to do an emergency baptism herself. After care, clean thermometer, instrument, equipment, and return in proper places, and also discard all disposable materials and soiled clothing properly in the proper place. For the documentation, evaluate the newborn status and conditions, establish a respiratory function, stabilize temperature, prevent infections and complications to the newborns. Prepares and perform cord care, restrain and let somebody hold the baby's hand and feet. Disinfect area around the base of the cord, going out on circular motion, and also disinfect from the base going up the cord using one cotton ball in each side. The cord 2 inches from the base using califorceps. Cut the cord above the cord clamp approximately 1 inches above. Inspect the cord for AVA and for any undesirable signs. Do proper evaluation of the infant using measurement, weight, height, head circumference as for hospital's policy and record. After that, insert rectal thermometer and observe for any unusualities. After that, clothe the infant.